Kenya has recorded 2,844 new cases of COVID-19 in a sample size of 10,215 in the last 24 hours. This means that the positivity rate has slightly dropped to 27.8%. From the cases, 2,562 are Kenyans, while 283 are foreigners. This brings the total confirmed cases to 267,571. Meanwhile, Africa Center for Disease Control, or Africa CDC, is now urging African states to scale up vaccine rollout and strategy in a bid to curb the spread of COVID-19 and emergence of new variants. The Africa Union body says the low uptake of vaccines in the continent is no longer a vaccine hesitancy issue, hence the need for governments to reconsider their approach to the pandemic and ensure vaccines reach the people who need them most. Gloria Mulimu reports.
The emergence of COVID-19 variants is no doubt a concern for health experts. This can only mean that the virus is thriving and is more likely to infect more people. However, in a bid to halt the transmissions, health experts are calling for change in strategy in the fight against the virus that has seen Kenya's positivity rate spike in recent days. Among the proposals by Africa CDC is expansion of surveillance through the use of rapid antigen tests to identify hotspots. But how does this work? Dr. Julius Oyugi is a virologist and the director of research at the University of Nairobi's Institute of Tropical and Infectious Diseases. He helps us understand what this targeted vaccination approach entails.
If your goal is to reduce the burden of COVID-19 globally or in a community using vaccines, there are two approaches that one can go for. The first one is what we call targeted vaccination approach. And this kind of approach involves knowing what we call hotspots, which part of Kenya or Nairobi have the highest burden of COVID-19. And for you to know that, you must do testing of COVID-19. We know that the current gold standard for testing is called PCR. PCR, you cannot use it to test a large number of people because of the costs. But the alternative is the antigen test, which is cheap and you can get results within a short time and you can test a large number of people. So antigen test can actually help us to identify what we are calling hotspots for COVID-19. And with these hotspots, you can now use the targeted approach for vaccination, where the vaccines that you have, you only go and vaccinate people in those hotspots region.
The virologist explains that the other approach is mass vaccination targeting everybody. This may involve moving from door to door. However, this approach may not be feasible because the country does not have a lot of vaccines to facilitate that. And so the best approach would be to use targeted approach that can be further broken down to risk groups to include people with underlying medical conditions, the elderly, teenagers, and later on children. Similarly, this approach has its demerits.
We know that they also have disadvantages. For example, depending on the setup where this antigen testing is carried out, what I mean by setup is when you are testing in a community where there are a lot of people who have COVID-19, the results outcome differs if you are doing testing in a region where the COVID-19, the number of people is very low. The problem, it has a problem we call getting false positive results. That is number one. Number two, if you got COVID today, it takes time for you to build enough antigen, to be able to be picked by this test. So there are occasions where you could be carrying the COVID-19 virus, but you test negative for using antigen test.
Africa CDC also proposes the need to take vaccines to the people as opposed to waiting for them to go for the vaccines. This coming at a time when the Ministry of Health says vaccines uptake in the country has increased from 20,000 doses on a single day in the month of November up to 80,000 doses per day. This is a steady increase that is attributed to a number of approaches like the outreach programs and use of religious leaders who help in spreading the vaccination message. With just about 3.6 million people having been fully vaccinated and just over 5.3 million said to have received their first dose of the vaccines, the government says county governments also have a role to play in scaling up the vaccination numbers in the country. Africa CDC indicates that as of December 17th, Africa had administered 64% of the vaccines it has received. Gloria Milimu, KTN News.